Hey, it's Satori here from Acupuncture and Herbs. In this video, I'll be teaching you the most essential things for recovering from trigger finger. By following these, you can avoid painful surgeries or steroid injections. Assuming that you're watching this, it's likely either you or someone you care about is experiencing a trigger finger or fingers and considering undergoing the painful surgery. When it comes to a standard treatment for trigger fingers, it's usually the same for everyone. You'll see a doctor who will diagnose you and prescribe anti-inflammatory medication to reduce inflammation. If the medication works, you'll feel better, but if it doesn't, your doctor may suggest a steroid injection to the affected finger. Studies shows that 86% of people with trigger fingers improve after the initial injection. But if you've had it multiple times, your success rate may drop significantly. If you've had more than 3 injections, your progress may not be good. In that case, your doctor may suggest surgery to release the tension from the locked digit by cutting and opening your finger. I want to advise you that surgery should be considered as a last resort. It's not recommended in the first place. If I were in your shoes, I would look into the alternative treatment before considering the surgery. This is especially important if you're relying on your hands for work or hobbies such as playing the instrument like the guitar or piano. It's worth exploring all the options avoid to such drastic measure. This is what I want to teach you about. Those things that you can be doing very beginning, even when you start getting medicated steroids. These are the things you can be doing there. The 3 main things. So number 1, reducing inflammation is really important. Even if you are taking medication, you might still feel a lot of pain and tightness in your joints. This could be because inflammation that just won't go away. It's really important to deal with this because inflammation can block your tendons and make you hurt. Basically, we need to put out the fires of inflammation to stop it from causing more damage. And number 2, in order to alleviate the trigger finger, flexibility is a key. This condition occurs when the space between the tendon and tendon sheath is narrowed. The tendon sheath is similar to a tunnel, and tendon act as a train. When either the tunnel or train is damaged and swollen, the pathway becomes trapped. However, the tendon is elastic like a rubber band and can stretch and loosen. If your joints are flexible and loose, even with the swollen tendon, it can prevent joint locking by smoothly sliding through the tunnel and space between the tendon and tendon sheath. So we need to go in there and start promoting the flexibility of the tendon. The ultimate purpose of number 3 is to give enough nutrients to the tendon. Because whatever the reasons, your tendon and tendon sheath are damaged and require a lot of minerals and nutrients to promote healing. Because your blood brings all the important stuff your body needs to heal properly, it's necessary to make sure your blood is flowing well. Our bodies are truly amazing. They have a power to do so much on their own. Without any outside help, they can decrease inflammation, increase the flexibility, and even boost blood flow to the damaged area. All of these processes happen naturally within our bodies. It's pretty incredible, isn't it? Recovering from an injury can be different from everyone depending on how much damage there is. If your trigger finger only has a little bit of the damage, you should be able to move it again in a few weeks to a month. You shouldn't have any problem with it getting it stuck or catching it. But if it's a moderate to severe damage, these are the cases that we worry about, because it can take up to 2 to 3 months and you gain a little movement in your joints, okay? And I know that's very frustrating. And you're like, will this get better? Or do I have to have a surgery? Now, that's the thing your doctors don't talk about. What your body's doing or trying to do. And you can support the process. You don't have to wait. And you could offer some help and lend a hand in that situation. A lot of different things to do there, but in our clinic, for example, we support the process with acupuncture. It can reduce the inflammation. We can help increase the tendon flexibility and restore the minerals and nutrients by promoting blood flow to the fingers, okay? There are actually a few different ways to get this done, and there are a bunch of other techniques you could try too. You can find an evidence-based method online that can be useful, but it's a good idea to start doing these things now. So let's discuss the timing for when you would like to start these tasks. Keep in mind that procrastination can worsen the issue with the trigger finger. At first, you might feel some tightness in your joint only in the morning, but over time, you may start to notice some clicking or cracking in your joints, and you might feel a tender bump forming at the base of your finger. If you leave them alone, your finger may occasionally become stuck in a bent position. At last, if you waited too long to take care of the damaged tendon, your finger could end up feeling stiff and stuck for hours or sometimes several days. So, it's best to deal with this problem as soon as possible to avoid unnecessary discomfort. Suppose you happen to spot a bump on your finger or it feels a little tight. In that case, it's a good idea to get checked out as soon as you can, because it's tough to reverse the condition. Taking care of it early can make all the difference. Early treatment can help improve movement and potentially prevent the need for surgery. Like I said, the human body is remarkably resilient. Even today, I'm still amazed at the level of improvement that people can achieve. Let me give you an example. Despite having a trigger finger for 5 years, this person can now play the piano again without any surgeries. Sometimes our body can surprise us with unexpected needs. Sometimes it can be tough to figure out exactly what our body requires. And sometimes the body just needs a little push from outside assistance to regain its natural abilities. But it's important to try our best to take care of ourselves. So, I hope this video is helpful. If you wanted to learn our treatment protocol, please scroll down on this page and take the next step to see how specifically this process would work for you or what you can expect. You can scroll down and book the free initial consultation with us. What that is basically we sit down one-on-one in person and you just tell your story. What's been going on or how your body's doing. That's how we can tell what you can expect regarding improvement or your type of trigger finger. Thank you again. Take care. Bye.